Hi, welcome to Scoliosis Boot Camp. I'm Dr. Stitzel. This is my clinic, the little clinic that could, in Lidditz, Pennsylvania, America's coolest small town. We're doing a little bit of a video here just to introduce parents and patients to some of the methodologies and technologies and things that we're using here at Scoliosis Boot Camp. Obviously, parents have a lot of questions about how we're achieving the amazing results we're achieving. A lot of teenage patients in particular are having some anxiety about what it's going to be like. So this is hopefully going to solve both of those problems, all right, and provide everyone a little bit more information about a more modern, more updated approach to treating scoliosis. So as you can see, this is our rehab room here, and this is where kids spend actually most of their time while they're here at boot camp. We're obviously doing boot camp here 5 or 10 days, depending on the curvature size. And the kids are here for about 4.5 to 5 hours a day, depending on the number of snack breaks, pee breaks, whatnot, okay? And while they're here, again, each one has their own individual treatment plan, but there are a lot of similarities and a lot of things are used with every case. So one of the first things we do is we have the children warm up here on the scoliosis wobble chair here. And basically when they sit down on the wobble chair, they're doing various kind of exercises and things. And what we found here is that warm spines stretch and bend easier than cold spines. Imagine that, right? So this is the first thing we do is a warm up here. It lubricates the joints, it stretches the ligaments, it gets the discs ready. So all the things we're gonna do next is gonna be based on keeping this spine warm so it's flexible. We can make the curvature respond to the rehab and get great results for these kids. Hi, hey, we're here in one of our therapy rooms here, and everything in this room is designed to make the curve more flexible. What we see happening is when kids develop or patients develop scoliosis, we're seeing asymmetrical structures, so we get asymmetrical soft tissue adaptation to that. One of the biggest things we see is something called ligamentous creep. So basically, if we have a patient who has a curvature like this, the ligaments on the inside part of the curve are traveling a shorter distance than ligaments on the outside part of the curve, and the ligaments adapt to this difference in distance through something called ligamentous creep theory. And basically, the ligaments on the inside part of the curve creep shorter and thicker. The ligaments on the outside part of the curve creep longer and thinner. So what happens is when we try to do the rehab of the patient, as we try to get that curve to open up and untwist, that shorter, thicker ligament will act like a tether. So we need to be able to stretch that out and make that more flexible. And we do that in several different ways. One of the things we use here is something called our vibration traction. This is a very highly specialized vibration therapy. The patient lays here on their back, face up, and then the whole body vibrates in that position. And what we do is we put the patient in what we call a mirror image, or an opposite of their curve pattern and things, so that when they're vibrating, the muscles, the ligaments are relaxing, and as they do that, they're now stretching into the opposite direction. One of the other things we do is something called our Eckert table here. This is something called cyclic repetitive motion. What we know about ligaments is if you stretch them fast, they act like rubber bands. If you stretch them slow, they act like silly putty. But what we want is we want that ligament on the inside part of the curve to stretch and relax, stretch and relax, stretch and relax. Because by doing that, not only are we going to increase the flexibility and increase through something called hysteresis, but we're actually going to cause the ligament to adapt to that stress and become more flexible permanently over time. So the patient lays face down here, the table is then bent to the position to open up that ligament, and then the table just goes up and down and stretches that ligament. Now we also have muscles involved, and one of the things we do with the musculature here is we use a percussion massage instrument. This is something, the difference between this and other is this has a lot more juice, right? It's a lot more professional. And also, most massage tools will go side to side. This one goes up and down, so it penetrates all 5 layers of muscle. So again, we're working on those tight muscles so those can relax. We're working on vibration therapies. We're working on stretching therapies here, so we can target the specific ligaments and muscles that we want and need to in scoliosis to make that curve more flexible so the rehab can work better. We're in another one of our therapy rooms here, and this is something called our mechanical drop piece, or MDP. And what happens is that same vibration therapy that we're using for the vibration traction is also being applied here, but we're applying it directly to the patient's rib cage. So we also use that rotation and causing that rib hump deformity. What happens is the patient's placed once again in a mirror image here, so that we're de-rotating the spine with their positioning, and then we vibrate that whole rib cage here with that same special frequency that causes those ligaments to relax and allows us to move the entire rib cage. So this is something that's really popular with patients because it really decreases that rib cage rotation and that deformity. So this is my office and also my adjusting area, and we're doing joint mobilization with these patients. Now this can create some anxiety and confusion for a lot of people, but joint mobilization is really important in scoliosis because once again, increasing curve flexibility so the rehab can work better. Now the purpose of the joint mobilization isn't to make the patient straighter. That's the purpose of the rehab. Okay? The purpose of joint mobilization is to ensure a full and active range of motion of the joint so it can get a rehab effect. Now what that means in words and actions that people actually understand and use is, for example, if I want to rehab my bicep, I have to be able to bend this elbow. If I can't move this joint, I can't make this muscle work. If I can't make that muscle work, nothing works. So this is what we refer to as a torso trainer. It's one of the tools and rehab devices that we use very commonly in Scoliosis Boot Camp here. And this is one of the things we've developed over the last 24 years. And what you can see here is this is a long lever rehab device that's going to strategically throw the patient's center of gravity off intentionally so that it now signals the brain to realize that they're not lining up correctly and respond. It's referred to as reflexive response rehabilitation. So you can see also here, the foam here is going to be attached to the patient's hip. This is going to capture their entire rib cage, so we move the rib cage as one unit. You can see this is actually cut on an angle, so it's actually going to derotate the rib cage. So it's absolutely foolproof, right? It's going to derotate the rib cage every single time. We add weight to this end here, often somewhere between 8 to 16 pounds. So this is one of our also primary rehab devices. This is called a posture med, and basically it creates a very neurologically challenging environment. So while the patient is wearing their torso trainer, which we discussed earlier, okay, they're on here doing these balancing exercises. And you can see that the actual platform itself, okay, is moving around and responding here. And then I have the patient standing on an air cushion with a little board here, almost like a seesaw. So all they're trying to do is try and maintain equal pressure on both feet while they're doing the rehab. So they'll be wearing the torso trainer while they're doing this here. As you can see, it's not all that easy, but it's basically jogging for your brain and really increases that learning effect and that learning curve from the reflexive response rehabilitation. So this is the ScoliSMART activity suit, and this is probably what most people know or remember about us, okay? And most parents and patients see this and think and assume it's a different kind of brace, but in reality, it's not a brace at all. It's a world's first personal rehab system for scoliosis that uses the twisting and torque from walking and running and recycles that back in the activity suit so that the brain reflexively, automatically learns how to untwist the spinal curvature against resistance. Now it's really important it's done against resistance because when a muscle works against resistance, three things happen. The muscles get stronger, they learn how to work together again, and they send a feedback loop from the muscle back to the brain, muscle memory, right? That causes the spine to learn how to hold the spine in a better, straighter, less twisted position automatically over time, even when they're not wearing the activity suit. Now, this is usually used by adult patients for anywhere between 2 to 4 hours a day if they're using just the activity suit. However, many of our patients who are younger, teenagers in boot camp, who are doing the torso trainer as part of their rehab program, also use a suit, and often from somewhere between 45 to 60 minutes a day.